Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Since it's Heart Awareness Month, we're shining a spotlight on the silent symptoms of heart disease that are often brushed aside but could be life-saving if caught early. Today, I am joined by Cardiologist Dr Andile Xana to explore heart disease symptoms to never ignore to potentially prevent severe complications and give our hearts a fighting chance.
I'm Andile Xana. I'm a cardiologist. I currently work in Pretoria, mainly at Heart Hospital and at Life Regional Hospital. The kind of work I do, it's really I sit in the rooms in my office and I see patients, see what they come troubled by. Then I assess that using my equipment in the office. The ones who are fine, we send them home. The ones who are not fine, then we make a plan of managing them. I also do work as a physician, the internist, but that work is getting smaller as the cardiology work becomes more. So some patients will need to be taken to theater. Then in theater, basically, we normally fix the heart, either the blood vessels or the conduction system of the heart. We do that without cutting the patient, but putting up a drip. And then we use that drip to access whichever area we want to access in the heart.
Thank you so much for that lovely introduction, Dr. Xana. I guess let's go straight on to what we'll be discussing today regarding heart disease symptoms not to ignore. Dr. Xana, could you just mention some of the most common symptoms of heart disease that people often ignore or mistake for something else?
Chest pain is something never to ignore, especially at a certain age group, say usually that age group, men above the age of 45, and then ladies after menopause, or ladies and men who smoke, who have diabetes, who have high blood pressure. The reason why they get a chest pain is because one of the vessels of the heart is not conducting blood. So you get the sensation you would get if you tie your arm higher up, then you don't get blood going down that arm, and then arm will be painful and will be numb. So that's the same thing that happens in the heart. That pain you would get if you had to put something, a band on your arm, basically the heart is going through that. And that is the biggest killer throughout the world now, the heart disease. It's much more as the countries develop, it's much more. As the countries are underdeveloped, then it's less, but it's always on the up throughout the world. Wherever you go in any continent, it's always on the up. The only time that it stops is when it plateaus, where it reaches the top level. So it is the biggest killer. But then there are other conditions that are associated with the heart. It's like when you feel like your heart is jumping within your chest. Generally, that one, it's usually abnormal heart rhythms. The heart has got its own electricity. But then when there's an abnormal connection in that electricity, then you can get these abnormal rhythms. Tiredness is another big one, because tiredness in elderly people and in people with diabetes, they might not feel the chest pain, even though they've got blockages in the blood vessels of the heart. So they might just be tired. Also, another cause for tiredness, it could be that the heart rate is very slow. The heart is not doing its work of supplying the blood to the body at the required pace. So it's like a child who's hungry, who's not able to work. The heart is not able to work, which work is to deliver the blood and oxygen to the body. Then the other uncommon causes, it's a sudden collapse, but also it can be deadly if you've seen the sports people, that they're usually young people that suddenly die on the sports field. So sudden collapse is not to be taken lightly. Even if the examination is normal, when somebody goes to healthcare givers that are on the field of play, that child is important that child is actually investigated by somebody who's got a bit of training on cardiac assessment. Those are the major important ones. Cough can be another one. Swelling of the legs, those are like due to heart failure. Those are the major ones really that I can think of at this present moment.
You mentioned that as we age, our bodies undergo natural changes. So how can we actually distinguish between heart disease symptoms and normal aging or stress-related symptoms?
Because the issue of so-called normal aging is that the heart diseases tend to happen as we grow. Yeah. So it's better not to self-diagnose and say it's normal aging, I'm getting old, because a lot of the patients we see, actually a lot of the elderly patients we see, they will say, no, I'm old. But then their GP would have recognized something. I would suggest that always when you think that it's normal aging, it is go to a primary healthcare center Somebody else must make that diagnosis. Don't make it yourself. If my car is starting to smoke, I must not say, no, it's the oil. I must go and change the oil. You can have lots of things that are being damaged. Just take your car for service and then you see what's wrong. Same thing with our bodies. If we are not trained to treat ourselves or other people, then we must probably consult. Same as healthcare workers. I mean, it's not a nice thing to self-diagnose and self-treat. It's always to get an objective eye. So normal aging, it shouldn't be a diagnosis of an individual. And the issue is, as we grow older, all the symptoms that I'm mentioning, they are not as succinct as they are when we are younger. So elderly people in their 70s, 80s, they will be having a heart attack, but they won't have a chest pain. They will just be tired. Or they'll be having heart failure, but they'll just be tired. And then they'll be having a very slow heart rate, and they will be tired. And then they call that normal aging. And the issue with normal aging also, it depends on the level of activity that the patient has. Because somebody who's sitting down in old age home hardly does anything. Then what they call normal aging would be different from somebody who's 70, who's running their business. So it's important that we get somebody, an objective ear, that's going to tell you that I have looked at the conditions that could be causing this. Because just by looking at it, you can see some of the problems. Without even examining, you make a diagnosis very quickly. So it's important that you at least go to your primary health care, and then somebody must tell you it's normal aging.
Just to expand on the symptoms, Dr. Xana, can you just mention some subtle or lesser known symptoms of heart disease that people should be aware of?
I must say tiredness is the biggest subtle condition of the heart. That is the biggest tiredness, because it can actually mean either the conduction diseases. Remember, the heart has got electricity. It's more like a house. It's got electricity. That would be your electricity. That would be the wiring that causes that, basically regulates the heart rhythm. And then problems that will present with tiredness. If you have piped water at home, that's plumbing. The heart has got blood vessels. So that's a sort of like plumbing. A problem that will cause tiredness. Then the heart has got valves like doors that allow movement in and movement out. So those are the valves in the heart. Problems in the valves will present with tiredness. So tiredness is the biggest subtle condition of the heart. Chest pain, I must say, it's fortunately generally all health workers throughout the world with a shout chest pain. Billboards shout chest pain. We watch movies, we see somebody holding their chest. We all know it's a heart attack. So that's less subtle. We diagnose it as lay people watching Generations, any other of the soap operas.
So, Dr. Xana, are there any important lifestyle changes or prevention strategies that can actually help people mitigate the risks of developing heart disease?
There are multiple levels where we can prevent heart disease. The most basic and the cheapest one is what we should do, which we don't do. It's called primordial prevention. Primordial prevention is that when you have a child and then you have a family, what you do, you practice healthy lifestyle. That is drinking water. That is having all your meals in small measures. That is seeing a dietitian to advise you that in my family, we've got these genes. What kind of food I must introduce my children to? Because my grandfather had a heart attack. My father had a heart attack. I don't want that happening to me. I don't want that happening to my children. So basically, you avoid all these fast foods as much as possible. If you have fast foods, it's an odd thing, but the issue that our children should enjoy food with less salt. They should enjoy less sugar. They should enjoy more cooked food, less fried food, and exercise and exercise and exercise. Couch potato behavior that we do and then we give it to our children. We are giving birth to children who are going to have the same diseases that we have. So primordial is basically don't wait for problems. Home cooked food is cheap and eating at home is much more bonding than eating in the restaurant. Walking, 30 minutes of walking per day, a total of 150 minutes of walking per week. That is enough. Your children must get used to that, be used to playing outside. And don't teach them all these bad tastes that we learn. Natural taste is sweet. All these other tastes we learn. That is the taste of fried food. That is the salt that we put on food. These are all tastes that we learn. We teach our children from a young age not to enjoy salt, not to enjoy fried food, to prefer water instead of fizzy drinks. Then we've hit it hard on the primordial prevention. The others are a bit more expensive. Primary prevention now is when I've allowed myself to have high blood pressure, to have diabetes, to have cholesterol. How you prevent yourself having a heart disease, you have to now try to lose weight, which you probably shouldn't have gained in the first place. if you had practiced a primordial prevention. And that is costly because to control all those diseases costs money, takes doctor visits. It entails taking bloods to check if all these things controlled. That is primary prevention now because you are preventing a cardiovascular event from happening. The last one now is secondary prevention. It means that now we missed out on the primordial, which is the cheapest. We've missed out on the primary, which is a bit cheaper than secondary. Once at secondary means that somebody has had a stroke, has had a heart attack. Now they're trying not to have another one. So that is a lot more costly, and the level of care that you need is much higher. The cardiologists are a bit more expensive than physicians and the GPs, and the equipment they use in order to make investigations is a bit more expensive. And the care that the patient will need is a lot more expensive. That is why if you are taking insurance, they always look at these conditions if they exist, because the insurances know we are likely to pay. And so the premium must be higher. So prevention.
Dr. Xana, just to wrap things up, could you just advise on what people can do if they experience sudden changes in their heart health?
The first thing to do really is to have a primary healthcare check. It's much cheaper. It's much more accessible. The waiting period for the help is much shorter. And usually that will be your own GP or your own primary healthcare nurse who's been checking you whenever you have flu. So they know how you are. Your health is in their file. It's the best place to go to. And also they get to see other things you didn't report. So whenever there are symptoms that you suggest, that's suggested they might be heart related, just go to a primary health care. They will decide, because you might be tired only to find that it's actually not the heart, it's the lung. So they must make that differentiation. Or you find that it's actually a shortage of some hormones. It's always better than to just go to a primary health care. It's going to be cheap and it's going to be much more at ease with the usual caregiver.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. And that's all for today's episode on heart disease. Remember that your heart is always speaking to you. Whether it's a subtle flutter, unexpected shortness of breath, or persistent discomfort in your chest, these symptoms are often overlooked but could be the early warnings of a much bigger issue. Thanks to Dr. Andile Xana for shedding light on what we need to pay attention to and why early action can make all the difference. Take care of your heart and don't hesitate to seek help when something falls off, because protecting your heart is protecting your life. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.